Hello, today I'll be presenting my infectious disease, Pseudomonas dermatitis. On the next slide is my table of contents. This is the order I'll be going in. Um, I'll discuss what is Pseudomonas, how the bacteria can be cultured or isolated, how it can be acquired, how it can be transmitted, the mechanism by which the bacteria cause disease, signs and symptoms, diagnosis, treatment, and prevention. On the next slide is what is Pseudomonas. The genus Pseudomonas belongs to the family Pseudomonas Daceae. The genus has over 140 species. Most of them are saprophytic. They are gram-negative. Some Pseudomonas are straight or have a little curve. The species are aerobic bacilli. They measure 0.5 to 0.8 micrometer by 1.5 to 3.0 micrometer. They move around by a single polar flagellum. Some species have several flagella. The image on the left is a picture of a gram-negative The image on the left is a image of the species Pseudomonas aeruginosa. Over 25 of the species are related to humans. Some of the species are Pseudomonas aeruginosa, Pseudomonas mallei, Pseudomonas multifila, Pseudomonas putida, and Pseudomonas florensis. Pseudomonas aeruginosa being the most common disease-causing form in humans. At the very top is a picture of Pseudomonas putida. The next picture is a picture of Pseudomonas aeruginosa, and that's on the bottom left hand. On the next slide, I'll be discussing how the bacteria can be cultured or isolated. Pseudomonas thrive well when it's on McConkey, agar, standard broth, chocolate agar, solid medium, like blood agar. Pseudomonas colonies can be identified on a primary isolation medium by colony morphology and gram stain. Isolated Pseudomonas colonies are identified by making of pigment by some species and by positive oxidation reaction on blood agar or Pseudomonas selective. The colors of Pseudomonas colonies may be yellow, cream, off-white, white, or it may not have a color at all. The common Pseudomonas species, Pseudomonas aeruginosa, develops very well on laboratory medium. It is isolated on eosin, methionine, blue agar, and blood agar plates. Ultraviolet light is used to examine Florensis P. aeruginosa colonies. Pseudomonas aeruginosa can grow at 42 Celsius. It can also grow at 25 Celsius to 37 Celsius, but the growth rate is very slow. When this species is incubated on nutrient agar for 24 hours at 37 Celsius, a minimum of 6 colonies types are produced. Pseudomonas aeruginosa is identified by the production of blue-green pigment. On the next slide, it's a photo of Pseudomonas aeruginosa. The colonies grown from a sputum of cystic fibrosis patient with a chronic lung infection. In the next slide, I'm discussing how it can be acquired. In a hospital setting, Pseudomonas can be found in soap residues, antiseptic, or cap liner adhesives. They're also found on mops, respiratory equipment, and taps. Pseudomonas species inhabits water, soil, and vegetation. They are found in They are found in healthy individuals, skin, stool, throat, and ears. People can also be affected by Pseudomonas aeruginosa from a contaminated swimming pool and hot tubs. The next slide, how it can be transmitted. In a hospital setting, the bacteria are transmitted from person to person by hands of healthcare workers or by using unclean material in the hospital. Since Pseudomonas inhabits vegetation, transmission can occur when a patient consumes infected water or foods. On the next slide, mechanism by which Pseudomonas cause disease. Pseudomonas are opportunistic pathogens. Pseudomonas species produce toxins and enzymes to kill immune cells and to degrade and invade tissues. Some examples are lipase, phospholipase, and exotoxin A, and there's other examples. The species Pseudomonas aeruginosa produces many factors like hemolysin, thermolabile protein, and protease, and toxic A to cause virulence in humans. Hemolytic glycolipid is toxic to alveolar macrophages. It is known to be associated with Pseudomonas aeruginosa pulmonary infections. Thermolabile protein is a leukocidin. It leases leukocytes from humans and other species. The leukocidin destroys many tissue culture cells and lymphocytes. Extracellular proteins can be produced up to 90% by Pseudomonas aeruginosa strands. Protease 2 can dissolve elastin. It may play a role in tissue damage like in the eye or lung. Toxic A causes damage by blocking EF2. EF2 is elongation factor 2. When this happens, the whole cell is unable to function properly. It disrupts protein synthesis in cells. It works in similar mechanism as diphtheria toxin. On the next slide, I'll discuss signs and symptoms. Pseudomonas infections are opportunistic infection. Any part of the body can be affected by this bacterium. Pseudomonas are known to cause infections in healthcare settings. It is known to infect immunocompromised patients, burn patients, and urinary tract wounds, and it also can affect the blood, causing sepsis, meningitis, and abscess. Excuse me. An individual may experience chills, fatigue, and fever, joint and muscle pain. This infection could cause liver, kidney, and heart failure due to low blood pressure. Illnesses like HIV and AIDS and cancer and cystic fibrosis may be at a high risk to contract Pseudomonas infection. Also, people who use mechanical ventilators are at risk. When Pseudomonas infects the lungs, this is referred to as pneumonia. It causes the person to experience shortness of breath, cough, and fever, and chills. If a healthy person encounters Pseudomonas, they may not be affected by it. The symptoms are normally moderate. Excuse me. If a person, the symptoms are normally moderate if a person develops this infection. For instance, an individual can develop an eye or ear infection or a skin rash. When Pseudomonas infects the skin of a healthy person, it affects the hair follicles, causing redness or abscess formation in the skin or draining wounds. If a person swims in a contaminated pool or hot tub, it can affect the person's ears and eyes. It affects an individual's eyes by causing swimmer's ear. A person may experience ear pain, discharge, itching inside the ear, swelling, and complicated hearing. The infection causes an eye infection in which the symptoms are pus, inflammation, pain, swelling, redness, and poor vision. On the next slide, I have 3 pictures of Pseudomonas infections. The first picture is an image of a hot tub skin rash on a person's back. The second picture is the photo of a patient with corneal keratitis. The last picture is an image of a person with otitis externa, which is swimmer's ears. To the next slide, I'll discuss diagnosis. To precisely diagnose a Pseudomonas infection, a doctor would conduct a physical examination. The physician would ask questions about the individual medical history, recent activities, and symptoms. To confirm diagnosis, the doctor may take samples of blood, pus, and tissue from the affected area and send it to the laboratory. Once the sample is in the laboratory, they will run tests to determine if Pseudomonas are present. This process will also help determine the best course of treatment. On the next slide, it's an image of a person with green nail syndrome, in which it is caused by Pseudomonas aeruginosa. On the next slide, I'll talk about treatment. Antibiotics are used to treat Pseudomonas infections. However, the infections are becoming resistant to several types of antibiotics. To ensure that a patient is given the proper antibiotic, a doctor may give the laboratory a specimen from the patient so they can figure out which antibiotic will be effective. Antibiotics like amikacin, gentamicin, colistin, and tobramycin are some antibiotics used to treat an infection. When the infection is critical, carbapenicillin and gentamicin are used to treat the infection. On the next slide, I'll discuss prevention. In a hospital setting, hands should be washed thoroughly. Wash and sterilize medical supplies are ways to prevent Pseudomonas from spreading. Patients should keep a close eye on their IVs and dressing if they are recuperating from a surgery or from another procedure. If one of those look wet or unsecured, the patient should report it to the nurse or doctor. Some ways to prevent Pseudomonas infections are staying away from neglected swimming pools and hot tubs. Fully dry the ears and cleanse the body with soap and water after swimming. I am done with my project. Thank you so much.